luckily, the healthcare sector is per se relatively immune against I would say, normal cyclicality in businesses, because the underlying demand driver is the need, the clinical and operational need for our products and solutions we deliver to our customers. This having said, it's obviously not that we are totally immune, but so far we see ongoing strong demand coming out of the US market, the European market, as well as the Asian markets. The only, I would say, setback we had this fiscal year is the zero COVID policy in China, which for a certain period of time almost paralyzed the country. But we expect this to relax over time. We also see that the measures the government in China takes to apply their zero COVID policy are differently designed and with much less impact on the economy.
Let's talk a bit about China, because from outside it's very difficult to assess how the situation is in the country. Perhaps you can give us a bit of an idea of how the health market is doing, given that there's so much economic uncertainty in the country.
The economic uncertainty is normally not directly affecting the healthcare market. It's a bit decoupled, and this also holds true for China. On the other hand, the zero COVID policy obviously had a direct impact. When people cannot leave their homes, they cannot get to the hospital and there are no procedures happening. So every revenue which is dependent on procedures was immediately stalled then in the respective regions. Therefore, there can be very direct impacts, but it's not necessarily the economic situation which drives it. It is more, as I said, the application of the zero COVID policy of China. Therefore, we expect to see much better momentum next year coming out of China, assuming that the zero COVID policy will be applied in a much more relaxed or much more economic friendly manner.